In this video, we are going to discuss about hair transplant course which we are running and how you can also successfully become a hair transplant surgeon and learn all the details and intricacy of being a hair transplant surgeon and can include this unique specialty into your practice if you are already into the practice of cosmetic surgery or dermatology. This is a unique hair transplant course which we are running for around 8 years now and have trained more than 90 doctors from around 25 countries in the field of hair transplant. And on our YouTube channel you can see the testimonials of all such doctors who have got trained from us along with their staff members also at times. So this is a totally unique hair transplant course, one of its own kind, which is being delivered or offered exclusively to doctors who are qualified to perform hair transplant as per their local ethical and medical guidelines. This is not for doctors who do not belong to those fields, who cannot practice the hair transplant as per the codes of the medical councils. So this is very important for you to understand. If you want to know whether you are eligible for this course or not, you can always call us at the numbers mentioned here on the screen and can know about your eligibility. This is a unique 1-to-1 training course varying from 3 to 10 days as per the mentorship program which you want to get trained in. This course is for the beginners, for the intermediate level practitioner, as well as who are well advanced into this practice. Please keep watching this video till the end so that you can know all the details of this hair transplant course being offered by Iicsam, which is a trademarked institute, International Institute of Cosmetic Surgery and Aesthetic Medicine. Post the completion of this hair transplant course, we expect you to be skilled in the field of hair transplant, various steps of hair transplant which are discussed in detail with you. And when you finish this course, we expect you to be market ready in this field of hair transplant, and you feel confident that you can independently go and perform these hair transplant procedures along with your team, rather than getting dependent on outsourced team where sometimes the quality may be not in your hands or may be compromised. I am Dr. Satya Saraswat. I am a gold medalist plastic and cosmetic surgeon. I did my MBBS, then MS in general surgery, and then did my MCH in plastic surgery, a 3-year course from Baroda Medical College after 5.5 years of MBBS and 3 years of general surgery. After this, I did my DNB in plastic surgery and cosmetic surgery and got a gold medal in the field of cosmetic and plastic surgery in the year 2007. Since 2007, we are doing hair transplant. Even before that, when we finished our MCH also, we were doing some hair transplants. So this is 2024 and we are doing hair transplants since for last 17 and 18 years and have done thousands of hair transplants and have treated lots of patients in the field of hair loss. So initially, like 17-18 years back, we were doing only FUT hair transplant. At that time, learning hair transplant was a very difficult thing for us as a newcomers to do. Most of the doors were closed for the newcomers to get trained in these new fields of hair transplant. So when FUE came in India around 2009 or 10, there were very limited centers doing it initially. And as usual, they were also closed door where nobody actually knew how this procedure was being performed. The real challenge was for us to know how to do it. Then initially I went to one of my colleagues who was also doing FUE at the time, and we got the first exposure into this procedure in a live patient viewing how the procedure was being done. Then we went to some workshops and conferences, but sorry to say those were very dismal training courses where we were hardly imparted the complete knowledge about the procedure, but we were not allowed to even touch the patient. It was being viewed, it was streamed from the procedure room to a screen, and there were like 50-60 guys sitting over there and just wondering what is going on. Because of our initial exposure with our colleague, we started doing very limited number of cases. Initially, we were doing 800 to 1000 grafts in a day. This is very important for you to know, because once you come for the training, you may see patients in whom we have done giga sessions, 3500 or 4000 grafts or even more in a single day. And you may think that you are slow initially. So every beginner is slow. We emphasize on you to do each and every step meticulously, correctly, rather than speeding up. Speed will come later on. Initially, you have to learn all the steps in a very perfect way, how to implement it, how to do it, how to plan it. So all those things. Then we did FUE for like 6 years. Since 2010-11 we started doing FUE. By the time 2016 we were doing a lot of hair transplant, but then we found out there were hardly any training centers in India. Then we established this institute, International Institute of Cosmetic Surgery and Aesthetic Medicine, and then we started imparting all our knowledge which we had gained. That was the year when I became a diplomat or a member of American Board of Hair Restoration Surgery also, as one of the first plastic surgeons from India. And we were doing the things ethically. We were trying to deliver the best of our results to the best of our capabilities. And you know that no medical procedure is always 100% successful, but we try to be as honest as possible with our patients. And then we felt that there is a need in the country for a good training institute where people can actually not just see it on a screen, something like that, but they can actually see how the procedures are being performed, and even the technical details of punches, machines, FUE, how to align your punch with the extraction method, the follicular units. All these things we wanted to demonstrate, because we believe that sharing is the best way of improving ourselves also. And the country needs a huge number of good trained hair transplant surgeons who can do ethical work. And then we started doing these courses initially. Initially they were in a batches, and slowly over the period of time we have decreased the number of doctors who can attend at any batch. Now currently we are more focused on one-on-one doctor training, and we allow them to bring a couple of their technical staff also, because you know that hair transplant is a teamwork. It's not a procedure where a single individual can do all the steps on his own, because it's very tiring. Long hours can be there, like 8 hours, 8 to 10 hours it can take for a bigger procedure. So we encourage you to bring your technical staff also. And regarding all these details, the batch or the mentorship, as we call our one-on-one training, where we are individually focused on a one doctor, and we want him to be absolutely confident in the way he can go out and start performing from the next day itself. Last week we had a doctor and their technical staff from Brunei, and by the end of their 5-day training they were so confident that they said that they're going to go back and start operating on the list of patients which they already have. That's what we want for you to learn. And in this training course, myself being a member of American Board of Hair Restoration Surgery and a member of International Society of Hair Restoration Surgery, and Dr. Preeti also being an American Board of Hair Restoration Surgery diplomat and a member of International Society of Hair Restoration Surgery are the faculty. We are routinely attending almost all the ISHRS World Congresses and attending these national and Asian and international conferences, where we try to present our work also in front of the esteemed delegates who are there. So we believe sharing the knowledge is one of the most important part which should be there in the life of a doctor. The way we have designed this course is that initially you get a recorded lectures, around 13 hours of detailed recording lectures, which include on the basics of hair loss, medical treatment in males and females, therapies like PRP and mesotherapy, and medical treatment. Very important part is medical treatment, how you should prescribe, how you should discuss the side effects and everything about these medical therapies. Then there is a detailed lecture on consultation, what all points you should never miss during the time of consultation. and a detailed consultation. Then we have a lecture on trichoscopy where we discuss with you how to plan, how to assess the donor site and see what kind of donor area there is, what is the terminalis to vellus ratio, how to calculate that, how to calculate the total number of grafts available, how to calculate the number of grafts required in an absolutely precise and mathematical way, and how to discuss this with your patient. Then after this detailed lecture about planning of the grafts and the consultation, then we have a complete pre-procedure preparatory part. How do we prepare a patient for a hair transplant? Then comes the actual procedure part where we have a detailed lecture on FUT, various steps on that, how to have a good scar, how to incorporate FUT in the practice, what all steps you should do in what way. Then another lecture is on FUE, graft extraction, and this also is a very detailed lecture where we share a lot of tips how you can improve upon your graft harvesting, how you can reduce your transaction rates, how you can handle the grafts in the best possible way. We have a separate lecture on local anesthesia and how to keep a check on the side effects, how to prevent those side effects, how to make the procedure safe so that you do not face any medical emergencies, how to segregate your sort of sort out your patients into a high risk and a medium risk and a no or low risk kind of patients. And then with the local anesthesia, how to make a local anesthesia, what's the composition of the local anesthesia, how to inject it actually so that there is minimal pain to the patient. Then we have a lecture, a detailed lecture on slit making, how to make the slits in an absolutely precise way, keeping in mind the natural angle, direction, and what kind of density you should be having during the slit making. And these are all very detailed lectures. Then after the extraction, there is a separate lecture on graft insertion, which we want you to discuss with your team members as well, like your technical staff. They should also see these lectures where graft insertion is shown. And in that insertion, we have forceps implantation method in detail, how to hold it, was a two-hand technique, and then we have the lecture is on implanters also, implanter pens, which as you all must be knowing, it's a sort of a recent advancement, not so recent, but still more and more people are incorporating the implanter pens into their practice. Then we have a very detailed lecture on the emergencies in hair transplant. If an emergency happens, how you should be dealing, what kind of infrastructure you should have, what all medicines you should have in your crash cart or emergency tray, so that you can deal with the any emergencies which you may face, because no procedure can be 100% fail proof that there is going to be no emergency. There are very rare emergencies which can happen, and that's why this is also very, very important. Then after that, we have a lecture on post-operative protocols, what medicines to prescribe, when you should call the patient for shampooing, how you should do the shampooing, what's the frequency of that, when should a proper thorough cleaning should be done, when the scab should be removed. These all the things are there in the lecture. And in the end, we have a lecture on how to set up your clinic, how much is the minimum space you require, what kind of equipments you require to set up your hair transplant clinic, and the basics of marketing. I'm sure every region, every area has a different way of approach towards the marketing. There are places where mouth to mouth is very important, and then there are social media centric kind of areas also, or countries or cities, and then there are newspapers which carry a lot of traction in some areas. So we do touch upon all these important points in our 13 hours lecture. We give you an access for that, and then if there is any query from your side regarding those lectures, we do organize online face-to-face resolution discussions or Zoom sessions where we discuss your queries. We also advise you, recommend you the books you should be reading and the equipment you should purchase before your training to establish your hair transplant practice. And once you have done everything, then we organize a hands-on training for you, so that when you come, you actually learn the procedure in detail. So now coming to the most important part, which is the hands-on training. So hands-on training is not unsupervised. You just can't go and do anything on your own to a patient. Our patients, our esteemed clients who have reposed their faith in us. So each and every step we do it, and then we hold your hand and we tell you how to do it. So it's not an unsupervised hands-on kind of course. You have to be eligible for that kind of hands-on training with our local bodies and all. And then after this, the hands-on training is also done in detail. Before that, we give you a training on the trichoscopy, how you should be doing a trichoscopy, what all, how to run that software which we have, and ours is a very advanced trichoscopy software. Also, we train you to do the dermoscopy so that you can find out features of routine medical problems like androgenetic alopecia, alopecia areata, trichotillomania, lichen planopilaris, alopecia areata incognita, frontal fibrosing alopecias, and all these medical reasons of alopecias are also discussed. After that, we help you in designing the hairline, how you should be designing, what are all the factors you have to consider in designing a hairline, and this will vary. So what are those factors which make you to change your hair line from a low to high or high to low, and according to their age, their male pattern baldness, the donor side. So there are a lot of things which we discuss with you, how to actually mark the hairline using a laser device, making it more symmetric. And after that, how to prepare, how to do the sensitivity test. This is very important. Then we have an in-house ECG machine, so we do all this thing. We show you how to do that. We give antibiotics. Everything is totally open for you to see, to record, to take the pictures with the consent of the patient. Then we take the patient into the operation theater where we demonstrate to you all the steps, and then a very supervised steps you are allowed to do, but under the supervision of the faculty, where you have to do the local anesthesia, slit making, and a prefixed number of which is already pre-decided as per the course, and then graft extraction and graft insertion, and how to handle the grafts. Then post-operatively, we tell you how to shampoo. Same thing, which are actually very important for you during your clinical practice. And at any point of time, we encourage you to ask a lot of questions so that, we can discuss each and every point which is going through your mind. Please remember, no question is a silly question. You may think that, it's a very basic question. Maybe, but we think that there is no question which is basic. Every question is very important. For you, it may be very important in your practice to know about that particular aspect or point, and we discuss it very, very openly. We spend a lot of time in discussing a lot of intricacies of the hair transplant, and you will be learning it directly from the diplomat of ABHRS, American Board of Hair Restoration Surgery, and it's one of the highest certification in the field of hair transplant, where you have to submit 150 cases, then 50 operative records, and 5 before and after, and then a lot of there are prerequisites, and then there is a theory and a practical exam being held around once or twice a year. And in this, the top doctors are taking exams, so it's one of the highest certification. Now we are also a faculty for, we are also an examiners for the American Board of Hair Restoration Surgery, and we are in the credentialing committee as well. So once you are learning from us, we not just teach you about the technical tips, we also tell you about the ethical parts of the hair transplant. So this is a brief about the hands-on training which you get at our center. So now there are 3 days courses, there are 5-day courses, there are 7-day courses, and there are 10-day courses. So you have to know that we have to arrange our patients, and we have to be very dignified in our approach when we are dealing with our esteemed patient. So all these things are discussed, and once you learn from us, we are very, very confident that you can go out and start practicing initially for some time, for a period of months or even a year or so. Whenever you're having a patient in your practice and you want to discuss the planning, we encourage you to do that at a prefixed time. We will tell you to call us, and then we will tell you about the technical, how you should plan out your patient. So this is the way we try to help you out in setting up your hair transplant practice. And believe me, there are a lot of, you must have heard about a black market hair transplant clinic where the doctor themselves are not doing the procedure, the technical staff does the procedure, doctor's involvement is absolutely minimal, and you are totally dependent, your results are dependent on the technical staff. But once you do your course, you will see that most of the steps you can do on your own, and once you are confident, then you can build up your team who can help you out in performing these procedures. So friends, it's a very great opportunity if you are qualified, if you are oriented, if you are interested in incorporating this practice of hair transplant into your already existing practice, or even if you are a newcomer and you want to know from where you have to begin your hair transplant. So we are there with you at each and every step, and if you are interested in taking this course, you are most welcome to call us on the numbers mentioned, or to write us a mail to us about your interest into that. And then at the first step, we see that if you are qualified to take this training from us, because we have very strict guidelines about who can take this training as per our guidelines. So ours is a National Medical Council guidelines which we follow, and then we will let you know that you are eligible for that, and then the entire process begin. And we have our course coordinator also, and she is there to help you out with all your queries at each and every step. So welcome all of you if you are interested, and then we will be happy to help you in setting up your hair transplant practice. Thank you very much.